Hello everyone. Our today's topic is about the boils. What is the other name of boils? We call it as furuncle. So, what is furuncle? It is a skin infection, common skin infection. So, what is boil? Boil is a acute staphylococcus infection of the hair follicles. So, here the disease, the infection that would lead to ultimately there would be pus formation and there will be central necrosis. So remember, foil or furuncle, it is an acute infection of hair follicle that is caused by which bacteria? It's the Staphylococcus aureus bacteria. So which bacteria commonly causes foil? Which bacteria commonly causes boils? It's the Staphylococcus aureus bacteria commonly causes the boil. Now, how do the Staphylococcus aureus, bacteria, this enter the skin? So this bacteria, it enter the skin through small cuts. Through small cuts, injuries, abrasion near a hair follicle. So what happens is that the body immune system, it sends the WBC to the infected area to fight the bacteria. That lead to ultimately to the pus formation and that lead to inflammation. Now what accumulates to form pus in boil? The pus, it is formed from the dead WBC cells, that are the white blood cells, bacteria and the tissue. So what are the visible signs of boil that would appear on skin? So the area that would appear as red, swollen, with painful lump that may be filled with the pus. So what are the stages of the boil? Let us discuss that. The first is the initial stage. It starts with the painful swelling, painful indurated swelling. Slowly there would be swelling extends with the tenderness surrounding the edema. After a few days, you will see the center, it softens and forms a pustule. So this pustule would rupture or burst, discharging greenish flow that lead to deep cavity that is lined by the granulation tissue that heals on its own. So there are few variations like the blind boil, it subside without suppuration. Of sty, it is a sty. Remember, it's a similar infection of eyelid follicle. Now, what are the common sites of the boil? It is most commonly seen in the boils occur on the neck region, back region, and near the auditory meters. That are the main sites. So, where is the boil most commonly found? It's found on the back and the neck region. Why is the boil in the external auditory meters very painful? Because here the skin, it is tightly attached to the underlying cartilage, causing there would be tension that lead to severe pain. Now, what are the complications of boil that could lead to cellulitis? Those who have low immunity, and infection, it can spread to neighboring hair follicles, or there could be lymph node enlargement. So the treatment is you have to keep a good general health. It occurs in patients who have a poor health, so improving overall health is important. Apart from that, incision can be given. Incision is a touch of iodine helps the pustule drain, and if the pus it does not drain spontaneously, what you can do is remove the affected hair that is involved. Apart from that, antibiotics they are usually not required except if the boils they are recurrent or multiple. So if there are multiple boils, always check for the diabetics. Now let us discuss about the abscess. Abscess, remember, it is a collection of the pus in the body. So there are three varieties of the abscess. One is pyogenic abscess, other is pyemic abscess, and third is the cold abscess. So which type of abscess is the most common type? It's the pyogenic abscess. So here the organism we know they can enter the body and form abscess. How organism enter the body? It can occur, they can be through the direct contact with the penetrating wounds, injuries, or through the bloodstream or through the lymphatics. So the infection that leads to death and liquefaction that occurs due to the proteolytic enzyme that forms the from the dead pleomorphic leukocytes that results in the pus formation. So abscess, remember, it is filled by a pus lined by a pyogenic membrane. That contains the dead tissues and the granulation tissue. So this pyogenic membrane, remember, it turns into fibrous tissue, and cavity it is covered with the granulation tissue, and that is transferred into the collagen fibers. That is how the healing occurs. Now, what is the most common type of abscess? Remember, it's the pyogenic abscess, which is the most common type. So, how can the organism it enter the body to form abscess? Through the direct infection, local extension, lymphatics, or the bloodstream, which lead to formation of pus in an abscess, cell death, and liquefaction that is caused by the proteolytic enzymes from the dead polymorphonuclear leukocytes that lead to formation of the pus in the abscess. And what is the abscess lined by? It is always lined by pyogenic membrane that is covered by dead tissues and the granulation tissue. So what happens if the abscess cavity it becomes firm? It turns into antibioma that causes a lump. So due to the pyogenic abscess, you will see inflammation. And what are the cardinal features of the acute inflammation? We have already discussed that before. They are remember they are rubor, dolor, Keller tumor, and loss of function. So remember that the rubor stands for redness, dolor for pain, Keller for heat, and tumor for swelling, and loss of function. This was given by Virchow. Now, why does redness occur in the abscess? Due to the hyperemia. So, why is the area of the abscess hot? Again, due to the hyperemia. So, what causes the swelling in abscess? Due to the presence of the pus. So, what are remember the key points of the pus? There would be, first of all, there would be elevated temperature that indicates the presence of pus. There would be prony edema with induration. So that occurs when the pus it is deep seated. Apart from that, you will see that the fluctuation test it would be positive. Now coming to the diagnostic methods, what are the useful diagnostic methods? So radiology can be useful when there is air or gas with the pus that reveals the fluid level or the opacity. Apart from that, you can do is the isotope scan that is used for locating the pus collection or infection site with the radioactive technetium after the intravenous injection. So it helps to you to diagnose the brain abscess, hepatic abscess, osteomyelitis, etc. Apart from that, ultrasound can be done. That helps you to detect the abscess in the liver or in the spleen. Apart from that, CT scan can be done that helps you to differentiate between tumor and abscess. Now, what is the treatment? So, when the pus it is not localized, so the conservative treatment includes elevating and drafting the affected part and starting antibiotic. So, when the pus, remember, it's localized to an area, we can do is drain it. We can also send the sample for culture and sensitivity testing, and after that we can give you the proper antibiotics. So remember, one you can do is the most important method is the Hilton method that is performed for the drainage of the pus. So remember, for entrance exam, when is the Hilton method used? When the abscess cavity lie close to the important nerves or the vessels. Here what we do is the skin and the subcutaneous tissue, they are incised, and the use of artery forceps is used to open the abscess cavity in order to avoid the vital structures, avoid an injury to the nerves or the vessels. So what anesthesia is commonly used to drain the surface abscess? We use is the ethyl chloride spray. So again, important part is when is the Hilton method preferred for draining an abscess? When the important structures like the nerves, vessels are present around the abscess cavity. So after making an incision, you break all the loculi and complete drainage is done. Apart from that, remember, counter incision can be given. So if the most prominent part of the abscess cavity is not the most dependent part, a counter incision that can be made on the most dependent part. So that will facilitate the drainage with the help of gravity. So a corrugated rubber drain, it is typically used to drain an abscess cavity. So in case of excessive bleeding, remember, a roller gauze that can be packed inside the wound and it is kept for the 48 hours next. So what are the key points? The rafting, the affected part is important in order to speed up the healing process. Antibiotic can be given, and based on the culture and sensitivity test, dressings can be given repeatedly after 48 hours. Apart from that, multivitamins can be given like vitamin C that helps you in healing wound, vitamin B complex can be given. Now the other type is the pyemic abscess. Pyemic abscess, these are the multiple abscesses that develop from infected emboli in pyemia. So it occurs due to the conditions like acute osteomyelitis, acute inflammation of the intracranial sinuses, and acute appendicitis. So there could be either, remember, bacteremia, septicemia, or there could be toxicemia. So bacteremia indicates the presence of circulating transient bacteria in the bloodstream, whereas septicemia, it is characterized by bacteria in the blood causing a clinical manifestation like the fever, rigors, hypotension. So that required treatment to eliminate the bacteria from the blood. Toxicemia is the either presence of toxins, either the bacteria or chemical circulating in the bloodstream that causes the systemic toxic symptoms. So what are the features of pyemic abscess? There will be multiple abscess, acute inflammation sign could be seen, high fever, rigor, chills, abscess that could be seen in the spleen or other kidney organs. So drainage of pus is important, identifying the primary source of infection, and sportive measure that could be given. The other is the cold abscess. Remember, cold abscess, it is characterized by, it is non-reactive in nature. So there would be no sign of inflammation. So there would be no presence of any inflammation sign like the heat, redness, pain, and it is associated with, remember, tuberculosis infection. What are the common site of cold abscess? It's the neck, axilla, chest wall, etc. So there would be brawny induration, edema, and tenderness. So cold abscess, it mainly results from the tuberculosis infection. So typically it would lack any sign of inflammation, acute inflammation like heat, redness, pain, and it is associated with the tubercular infection. The next is the carbuncle. What is carbuncle? Carbuncle is the infective gangrene of the subcutaneous tissue, and it is caused by which bacteria? Staph aureus. Remember that. So where it is seen? Remember, it is most commonly seen on the back region, nape of the neck region. Remember that for your exam. So where the skin is coarse, it is rarely seen on shoulders, cheek, dorsum of hand, etc. So what you will see is a sieve-like appearance. So why it is known as sieve-like appearance? Because they have a multiple openings on their surface that forms a cluster of communicating abscess. So that is why they look like a sieve-like appearance. Apart from that, there would be central necrosis that would be surrounded by a small area of necrosis that leads to its characteristic appearance. And it occurs predominantly in the males who are over 40 years, and it is associated with the diabetic. So what would be the treatment plan? You have to improve the general health of the patient, start proper antibiotics based on the culture and the sensitivity test. You can give is the antibiotic like the penicillin or the erythromycin, or you can give is the anhydrous magnesium sulfate and glycerin powder on the moist cotton that helps to burst the carbuncle. Apart from that, surgical drainage can be done. So whenever there is a central softening, you will see a central softening, then you go for incision. So large cruciate incision is preferred, extending to the margins of the inflammatory zone. So remember what distinguishes a carbuncle from other types of abscess. Remember that carbuncle, it is characterized by multiple communicating abscess with a sieve-like opening. Next is the cellulitis. Cellulitis, remember, non-suppurative inflammation that spread along the subcutaneous tissue. And most commonly organism associated is S. pyogenes. Remember that. Both the aerobic and anaerobic bacteria can cause cellulitis. So the organism typically enter through the wounds, scratch, abrasions, etc. So so there would be warm, tenderness, shiny appearance of the skin, edema with heavy induration that could be seen, red streaks that could be seen along the due to the lymph anginitis that affects the lymph. So rest and elevation of the affected part to reduce the edema. Antibiotic therapy can be given. Broad spectrum antibiotic based on the culture sensitivity can be preferred. So if there is a pus, you can go with the drainage, incision and drainage. The other is the ripsalis. So remember, it is acute inflammation of lymphatics of the skin or the mucous membrane, and it is caused by S. pyogenes. Group A pyogenes, and the mode of entry is wounds, scratches. The margin would appear here is bright red and it would be slightly raised. The margin is irregular and packed with the streptococci. On histopath, you would see the lymphatic spaces in the skin that are filled with the lymphocytes and mononuclear cells. There would be pus formation. As inflammation subsides, brown discoloration of the skin may persist. So the predisposing factor could be diabetes, begins as a rose pink rash that resembles the spread of grease on the paper. So it can be distinguished from the cellulitis by the ripsalis can be distinguished from the cellulitis by here the rash disappear on the pressure and feeling stiff, and you would see a raised margin of the rash, and million ear sign is positive that could be seen on the face. So remember, ripsalis can spread into the ear cartilage due to the cuticular involvement, unlike the cellulitis. The complication could be tissue necrosis can occur, lymphedema can occur, lymphatic obstruction can lead to localized edema that could be seen. The treatment is rest and elevation of the affected area. Antibiotics can be given. So that was all.